Jack is the best. He is just like the sweetest little kitten. He is super playful. He's really sweet. He loves to cuddle. We love him. He's just the sweetest little thing. He's so curious.
He sleeps
about
with
everything.
us every night. Like, he'll curl up right here is his favorite spot, and one of my shoulders, or second choice, one of her shoulders. But yeah, he's very cuddly, even with the other cats as well.
He's really sweet. We're really lucky to have him.
We first noticed that there was something a little off with Jack a couple days before we took him to the hospital. He was just at first not acting like as playful as normal, and he was just really lethargic. It happened really fast, like in the course of like 24 or 48 hours, it declined from like, he seems not himself to like, okay, something's really wrong.
When he initially presented to CSU, we were very concerned he might be suffering from feline infectious peritonitis. Feline infectious peritonitis is a disease caused by a feline coronavirus. It's very similar to SARS-CoV-2 infection or COVID-19 in humans. It's also caused by coronavirus. Cats with FIP are very often very unwell. Most of the times we see this happening in young cats and kittens, which is very sad, of course. But these cats can present with many different clinical signs, from effusive form, which is what we call vet form, with fluid in their abdomen, to severe neurological signs and even seizures.
We were just like so shocked and afraid. So they did explain to us that FIP was usually like a very fatal disease, but there was a newly approved medication that had really good results.
It's been actually a fascinating time to live in times where we went from 100% lethal disease to a really great prognosis for these cats. So usually now when I see cats with FIP, I give the owners about 85% success that their cats are gonna be completely fine and live happily ever after. And this is a huge change for cats, and especially in the United States, since last year, about June 2024, we are now able to prescribe medications like GS, which is an antiviral medication for these cats, and be able to save life of so many cats suffering from this horrible disease.
I've been involved in compounding for my whole professional career, and to be honest, being involved in FIP and being able to provide a treatment to cure what was an uncurable disease has probably been the number one most important thing that I've been involved in. I genuinely mean that. The specific formulation that Bova and Stokes have is unique. There's no other compounder in the world that has access to that formulation, and this particular formulation has been backed by multiple clinical trials in different jurisdictions around the world. It's quite rare that you'd have a compounding product that is backed by clinical trials. Almost 90% success rate of curing what used to be an uncurable disease is pretty incredible.
Once the FIP cleared up and we weaned him off of the steroids, he has yet to show any problems with anemia or anything like that.
Jack actually did really well. He's one of my star patients. Jack has now completed his 12-week treatment with the GS antiviral therapy, as well as his observation period. So we now believe that he is either in complete remission or he's been cured of FIP, and we hope that he's now going to have a great life and live happily as a cat.
I think that the biggest advice would be to take even like smaller symptoms seriously at the beginning. We're very fortunate to have been able to get him to a place that provided really good care. They even told us that if we had waited maybe even hours to a day longer, he might not have made it. It took a lot of patience, watching, waiting, and just like a whole lot of loving on Jack. But it was all very worth it in the end.